My name is Alex Guimaraes. I'm the section head of body imaging at OHSU. MRI stands for magnetic resonance imaging. It is a non-ionizing means by which you can produce cross-sectional images in any plane of the body and within any organ of the body. It's the modality of choice for imaging the brain. It's very exquisite for imaging cardiac function, and it's the modality of choice for imaging the musculoskeletal system. It's a means by which it gives very high soft tissue contrast, so therefore you have multiple functions, multiple views of imaging water. It's very sensitive to fat. It's very sensitive to various other functions. It can actually, it's very good at interrogating brain function. Nuclear magnetic resonance started maybe about 80 years ago. Various solutions were able to be interrogated based on their structure and by placing them in magnetic fields. Then the protons, like other odd versus even nuclei, have magnetic dipoles and therefore are able to be have energies that are able to be exploited for the nuclear magnetic resonance effect. And then later on, it was discovered that you could actually impose spatial gradients, and by putting in spatial gradients into a high magnetic field in 3 orthogonal directions, you've defined a Cartesian system, X, Y, and Z, and therefore you can image spatially then this idea of the nuclear magnetic resonance effect. Then you go from NMR to MRI. Why is an MRI called nuclear magnetic resonance imaging? It certainly could be, and it is a nuclear effect. Nuclear technologies were getting bad press, so there was a concern that the nuclear, the name nuclear in front of MRI would actually scare patients, although it's not using ionizing radiation at all. It has no radiation effect at all, but it is a nuclear technology. There has been no known evidence of a deleterious effect from exposing human cells or patients or anything else to high magnetic fields. The only risk factors associated with MRI are heat deposition, that you essentially transmit energy into your system, and then therefore receive it back with the receiving coils. Depending on the amount of energy that's deposited and the frequency by which, for lack of a better term, frequency or temporal, how quickly you actually transmit that energy, you can deposit some level of heat. There are many safety hazards associated with MRI. At least to this point, there are pacemakers. So patients with pacemakers or cochlear implants, those are contraindications to having MRIs. In addition to that, if you have metal deposited in your eye for a fragment, if you essentially are somebody that works with flying objects, or if you had shrapnel in your eye, those are contraindications because those metallic objects can heat. They can absorb some of that energy, but they also can move because you're essentially, when you're moving through the fringe fields of the high field, you actually can move a magnet as you would when you're going, if your compass is moving in various magnetic fields. It can erase your credit card, so you probably don't want to take your beeper or credit cards or anything else. Those are contraindicated but not lethal. It also can pull in a large metallic device, such as an oxygen canister or a wheelchair or a gurney. All those things have been known to have occurred, and therefore many safety precautions occur with MRI. There is a shielded door that has multiple signs on it. The technologists are all well versed in safety, and so that those things don't happen.